It's okay. You're gonna get up? Come on. No, just hang on to your hand. That's it. It's okay. Come on. Put your feet on the floor. Put your feet on the floor.
Australians are living longer, with more of us over 65 than ever before.
Do your shoes up. Do you just do the laces up? Just do them up. Do the laces up.
Instead of going to an aged care facility, many of us want to age at home.
As far as I'm concerned, the longer she can stay here, the happier we'll be.
In 2024, in response to the Aged Care Royal Commission, the government announced its reforms, including a program called Support at Home.
Reforms like this don't happen every day. They are once in a generation.
Less than a year in, assessors, clinicians and aged care experts say the system is failing. More than 250,000 older Australians are waiting, either to be assessed or to get the full funding they've been approved for.
It's a pure financial decision. This is how much we can afford, and that I call a calculated denial of service. Government is making a political calculation that it can get away with not funding people who itself has assessed as needing services.
At the heart of the government's Support at Home reform, a secretive algorithm which decides how much funding someone receives. Assessors can't override its decisions, and elderly people who challenge it mostly fail.
The system is designed to be a black box. Practitioners, the ordinary person in the street has not got a hope of understanding what's in the algorithm.
Four Corners investigates the inner workings of the government's once-in-a-generation reforms and reveals how the strategy meant to fix aged care could be costing both the elderly and the taxpayer.
They say they want to keep you in your home, but why are they making it so damned hard?
Head tap.
Oh, wait a minute, we've got to change the battery.
Head tap.
Okay.
Sean Dorney at the Octetti mine site for ABC News.
Sean Dorney asked Michael Samari what he thought had gone wrong.
Over more than 3 decades, Sean Dorney brought us stories from the Pacific.
I'm standing on Mount Fubalin. Sean Dorney at Octetti for ABC National News.
20 years ago...
As the ABC correspondent, he was the man on the ground, covering coups, elections and conflict.
The soldiers came just after breakfast.
Nowadays, the news for Sean Dorney isn't good.
How are you, Sean?
Morning.
Yeah, thank you.
Shall we start?
I'll take this off.
Yeah, bent.
Thank you.
Almost 10 years ago, at age 66, he was diagnosed with motor neurone disease.
Motor neurone disease is not very pretty. And I need a lot of help to do almost everything. Also, I'm too old for NDIS, so aged care doesn't have anywhere near the support and capacity that you get in NDIS.
Under the NDIS, Sean could have received 3 times more funding. Sean's aged care funding gets him just 12 hours of care a week. But because he needs 2 carers, he can only afford them to shower, dress and feed him 3 mornings a week.
You right?
Yeah, it's all right.
That's okay.
Thank you.
Yeah, thanks. Okay, you're welcome.
The rest of the time, all those tasks fall to one person, Sean's wife, Pauline. They met in PNG in 1975.
I was extremely attracted to her and she wasn't so attracted to me, but I wore her down in the end. I'm exceptionally fortunate I've got the wife I have. Thanks, Tommy.
Open.
The constant sort of routine of showering, dressing. Yeah, it's a lot of work. Now, you ready?
Yep.
Feet on the ground?
Yep.
Yep. 1, 2, 3. Oh!
Yep.
Yeah.
My leg's caught there.
Oh. The time will come when I'm going to need night care as well, because I'm doing all the night care. And there are times when it's really, really exhausting. All right, it's done.
Good night.
Okay.
Under the old system, Sean was on the highest level of funding. With support at home, there's now more funding available. To get it, Sean just needs to be reassessed to see if he's eligible. In December last year, Pauline applied for Sean to be reassessed.
You have reached the Metro South Aged Care Assessment Team. Please listen carefully.
Under the reforms, the government partly privatised the assessment process.
Inquiring about the waiting time for home care.
Today, almost 100,000 elderly Australians are waiting to be assessed. When we filmed with Sean and Pauline in May, they'd already been waiting 5 months for the assessment.
Please be aware that there is a long wait for assessment appointments. Thank you for your patience.
The whole purpose of getting a reassessment is to allow there to be greater care so that, you know, Pauline gets a bit more help, you know, during the week for just everyday things to help me survive.
Hi, you guys are here now.
Yeah, we're ready to go.
All right, good. Okay, you coming?
Yeah.
How long do you think you can keep going on the current situation?
As long as I can. What else is there to do? What else can you do?
So the median wait time for assessments is consistently under a month, but as per the laws of mathematics, that means that some people are waiting more than that. That often depends on geographic distribution and availability of assessors. And where there are individual cases where people are waiting an unnecessarily long period of time, I'm always happy to follow them up personally.
From applying for care to actually receiving it, the median wait time is 10 months. In 2024-25, more than 4,800 people died waiting for their approved aged care funding.
So we're talking about thousands of people dying while waiting for their funding.
Well, I think it's always a tragedy if people pass away while they're waiting for care. And so my focus and our government's focus is on driving down those wait times. That's how we reduce the number of people who pass away without receiving the care that they deserve.
Officially, more than 100,000 people are waiting for the full funding they've been approved for. But Four Corners can reveal the real number is actually higher. After the reforms began last year, the department changed the way it calculates the waitlist, removing anyone receiving interim funding. If the waitlist were counted the same way as in the past, the number jumps by more than 53,000. Not 100,000 waiting for their full level of funding, but more than 153,000. Why did the government change the way it counts those on the waiting list to exclude people getting interim funding?
The waiting list has always been manufactured or calculated the way that it currently is.
That's actually not true. Since Support at Home and your reforms, you've changed the way it's calculated.
People go on interim packages for an average of 10 weeks, but we still use the national priority system to prioritise people's care in the way that it always has been.
So are you saying that the 100,000 people on the waiting list right now include people on interim packages?
No, once people receive the care package at the level that they have been assessed for, they no longer count on the national priority system.
Eight years ago, Four Corners exposed abuse, neglect and suffering in residential aged care facilities.
She was being abused. She was being physically abused.
The day before the first story aired, Prime Minister Scott Morrison called a royal commission.
We discussed this together as a cabinet and we decided it was necessary to move forward with a royal commission into the aged care sector.
After 2.5 years, the commissioners made nearly 150 recommendations. They said that from now on, governments must not ration care, but properly fund both residential and home care.
The Royal Commission said, we need a brand new aged care program. If you are being assessed by government approved means as needing care, you should get that care promptly.
Well, thank you.
When the report was released, opposition leader Anthony Albanese was scathing of the long waiting list for home care.
The idea that you can have an approved aged care package and then die waiting to actually receive it is just extraordinary. We can do better than this, so much better than this.
In the lead up to the election, Labor put aged care front and centre.
We will look after our older Australians. No one held back and no one left behind.
The government certainly has poured a lot of money into wages and staffing, and to be congratulated for that.
But Ian Yates, who spent 2 years inside government as its own aged care watchdog following the Royal Commission, says the government continues to ration care, evidenced by the long wait list.
It's going to make you wait 6, 12 months to get that, unless you're one of that tiny, tiny number that are very urgent. The only rationale for that can be budgetary. I know that in the post-Royal Commission environment, the central agencies, by which I mean Treasury, Finance, Prime Minister and Cabinet, were very worried they could have another NDIS on their hands.
It may appear that when we make people wait for service delivery, we are deferring the cost of funding their support. And that might look like a saving in the short term. But in that wait time, decline accelerates.
Former Aged Care Inspector General Natalie Siegel-Brown says making it difficult for people to stay at home will end up costing the taxpayer more. On average, it costs less than $30,000 per person to stay at home, versus on average $117,000 in residential care, roughly 4 times as much.
We are facing an urgent imperative to rethink the way we're administering this aged care budget and supporting people to age in place, which is far cheaper to the government.
The former aged care watchdog, Ian Yates and Natalie Siegel-Brown, both say the only explanation for making people wait after they've been assessed is a budget constraint. Is that the case?
We've invested heavily in the aged care system. We need to make the sensible decisions about how we spend those taxpayer dollars to get the best outcomes for older Australians. That's my focus, that's the Prime Minister's focus, and it's the focus of all the policy decisions that we make along the way as part of this reform process.
Audrey Stanleyland has been getting care at home for over a decade. Now 96, she lives alone in her home of 43 years in Perth. Audrey is blind due to macular degeneration. Audrey and the 300,000 others already receiving home care were told they'd be no worse off under the reforms.
How are you, my love? Oh, are you okay?
Yeah, all good.
But Audrey and many others say they are worse off.
Give me a kiss.
That's because, as part of the reforms, providers had to reduce their administration fees to just 10%. After the change was introduced, many providers increased their hourly rates, some by more than 30%.
Nice to have a bit of quiet.
Audrey's fees went from $90 to $115 an hour, meaning she couldn't afford the same amount of care.
Do you want me to start getting your soup ready, or do you want to wait a while?
I will wait.
We've had to cut hours. She gets assisted showering 3 times a week. No worries, Mum. I think what she's missing out on most of all is having someone in the house here with her.
And Audrey, when you don't have the carers here, what are your days like?
Horrible. You just sit on the lounge. You can't do much. It means a lot having them here. You feel more secure.
You okay?
Mm.
Audrey's daughter Jan applied for her mother to be reassessed, hoping for a higher level of funding.
I didn't know that.
You spilt it on the floor.
Yeah.
And all Mum would be getting is not extra, it's just going back to where she was. Where's your placemat gone?
Okay.
You right?
Yeah.
Okay. Just let it sit. Make sure it's not too hot. With you?
Audrey was previously assessed more than a decade ago.
Does it taste all right?
This time, under the reforms, it was done using a classification algorithm. The assessor used a new electronic questionnaire, the Integrated Assessment Tool. It has hundreds of questions for which Audrey scored points about things like showering, cooking and cleaning. Along with the questions, the assessor tested Audrey's mobility.
She just came in, sat at the end of Mum's kitchen table with her laptop, and she would ask the question and then tap away on the laptop. It was a tick and flick.
Audrey's answers to these questions were fed into the algorithm to decide on her level of funding.
I was very worried about a computer making a decision on a human being, that the person in the room could see Mum's condition.
Days later, Audrey received the results. The classification algorithm decided Audrey should remain at the same level of funding she'd received 12 years earlier.
It was just basically saying that, no, you're unsuccessful for it. I was gobsmacked.
Since it was introduced late last year, the algorithm has been shrouded in secrecy. But with the help of expert Professor Kathy Eager, who has spent decades designing health funding algorithms, we can reveal how it works.
The practitioners, the ordinary person in the street has not got a hope of understanding what's in the algorithm. This is my technical area of expertise. I've been able to unpack the black box. An algorithm is a decision tree, and like any decision tree, a tree has branches. And the other thing is...
The first branch of the tree allocates you points for how you function.
Different aspects of mobility. Everything from can you drive a car to managing activities of daily living at home.
The next branch gives another set of points based on whether your needs are being met.
And then the next level of the algorithm is what they call compounding or complicating factors.
On this final branch, things like frailty, cognition and other health conditions finally enter the equation.
What it then does at the end is amalgamates all those groups into 8 funding levels.
This determines how much funding you get. She says the problem with the way the algorithm works is that crucial questions about cognition, frailty and other health conditions are only considered in the decision tree too late to have an impact.
People are receiving care at home for one of 2 reasons substantially. They're really frail. And then the second is, does this person have a cognitive impairment? Can they be left at home to make their own decisions? They come in at a point where their impact in the model is absolutely immaterial.
The other problem is this. Even though assessors ask more than 500 questions, the vast majority are not fed into the algorithm. The algorithm doesn't take into account the clinical and social observations that assessors can make in more than 100 text boxes.
Are you aware that the vast majority of information in here does not go into the algorithm? It is not read by the algorithm. It does not determine someone's classification level.
I don't agree with that, Anne. The classification and prioritisation mechanisms draw the data that they need in order to get the best outcome for older people.
The clinical notes that are written in more than 100 text boxes in the tool are not read by the algorithm. Is that acceptable?
The notes that are collected by the clinical assessors are critical through the broader parts of the integrated assessment process in order to determine what the care allocation is for that older person.
So this is a case mix classification.
Professor Eager says the algorithm is also statistically flawed. At one branch in the decision tree, a single point in a person's score can mean someone gains or loses almost $40,000 a year in funding. How statistically flawed is that?
It is fundamentally completely flawed, and the technical problem is a different one to the policy problem. I mean, it doesn't pass the pub test, but it's because of the design of the whole classification.
Does the algorithm know that she's blind?
We obtained the results from Audrey's assessment to show Professor Eager.
And this is one of those that is really not justifiable. How can this frail old lady with all these problems get less hours? And the answer is the way the algorithm works.
Audrey's daughter Jan appealed the algorithm's decision. To do so, she was required to write and post a letter to the department at a South Australian PO box.
And so what was the response?
There was no response. So I received the notification as a request for the review, but they said that if I hadn't heard anything in 90 days, I was unsuccessful.
So you didn't receive any other advice from them about...
Nothing whatsoever, nothing. Just breathe slowly. Just breathe slowly, Mum. She's going to have to pay money or she's going to have to go without services. That's the only way. They say they want to keep you in your home, but why are they making it so damned hard? That's what I don't understand. You'd think they'd be making it a bit easier for you, but they're not. They're making it a darn sight harder. They just throw you on the tip. You've had your day, so you're no good to us anymore, you're a liability. That's the attitude I get.
Five months into the reforms, more than 1,000 people had appealed the classification algorithm's decisions. That's almost 6 times the number who appealed in the entire financial year before the reforms. Of about 900 reviews, 207 were successful.
There's been around 1,000 people asking for their decisions to be reviewed. Doesn't that tell you that there's something wrong?
In the first half of this year, we assessed more than 250,000 Australians. We had less than 0.5% of those assessments have reviews sought. No single system will get everything right, of course, so we need a robust review process. But in terms of proportion of the overall workload, 0.5% is, to my mind, a relatively tolerable number.
The reason that it's a very small percentage is because it's too hard and complex to appeal, and also people are giving up. They know that if they appeal, the appeal is being considered by the very department that developed the system.
Professor Eager says while the algorithm isn't unlawful like robo-debt, the process to appeal it has similarities.
In robo-debt and here, the onus is on the consumer or the frail older person, and in the case of supported home, they then have to challenge the algorithm. Nobody has to justify why the algorithm gave them that. The onus is on the older person and their advocates to say it was wrong. But the Commonwealth is hearing these appeals, and the Commonwealth has vested interest to give people as little as possible because it's the funder. And I would certainly maintain that the whole appeals system, the department has a conflict of interest.
The minister said the government will legislate a new pathway, allowing assessment agencies to ask for reviews of decisions when necessary. But this month, it voted down an amendment passed by the Senate to allow assessors to override the algorithm's decisions. While the government's classification algorithm determines your level of funding, a separate priority algorithm determines how quickly you get it, including funding for home modifications, walkers and wheelchairs.
What's for lunch? That looks good. Hi. Hi. Nearly finished yours?
Yep.
So, we go and have your shower?
Yeah, how hot's the water?
As hot as you want it. Come on.
Karen Smith's mother, Barbara, has advanced dementia.
Come on in. Just going to have a shower, Mum.
She lives at home with her husband, Don. Both are in their 80s.
Dad does most of the caring. He does all the washing, he does the shopping, he does the driving, he does the cooking, he puts her to bed. So he's doing 99% of the caring for Mum.
In January, Barb received funding for carers to come and shower her.
That's my husband outside. I don't know what's happening.
But instead, her daughter Karen has to do it because there's no handrails in the bathroom and her aged care provider says it's too dangerous.
Make the most of it.
Yeah. I come around every second day and give her a shower.
Barb's approved for handrails and a ramp outside, but the priority algorithm has ranked her at the lowest level of urgency.
I'm here. All this time.
When we visited in May, she'd already been waiting almost 5 months.
I just get frustrated. I know what I want to get done. I know they've approved it. I just keep asking the question is, when is it going to get done? Because I'm not getting any younger.
Under this algorithm, Barb would only be high priority if she met at least 2 of 5 criteria. Lives alone, has a mobility impairment, is Aboriginal or Torres Strait Islander, lives somewhere which poses a risk to her, has been waiting 6 months, while living in a rural or remote area.
It's bizarre. It really is. And no one can explain to me how that works, that mum is considered the highest need level, but the lowest priority for the funding, for the equipment that's actually going to help her stay at home. Mum and Dad have been married for 60 years. They want to stay together. You know, Dad is happy to have Mum still here, but it's going to get to a point that he's not going to be able to if we can't get the service, you know, the equipment and things that make that possible for him.
Out of more than 100,000 people counted on the official waitlist for supported home funding, just 88 are classified as urgent by the priority algorithm. Why is the bar set so high? And people say it's deliberately set high so that you do not have to fund the system.
I'm dissatisfied with the way the prioritisation mechanism is working. We're part of the way through a rapid review, a 3-month review into the prioritisation mechanism, and I'm awaiting the outcome of that review so that we can continue to make the necessary changes to get the best outcomes for older people.
I have some questions.
At Senate estimates, the design of the algorithms and the fact that assessors can't override them has been under the microscope.
So was there a specific consultation where people were specifically consulted on removal of human override?
No. I put it to you that this algorithm is not actually working.
Do you have any data on what that...
It was revealed that while the two algorithms were originally designed by consultants, it was the department that finalised their development.
We then took the algorithms in-house and finalised their development, and then they were tested on 200,000 completed assessments in relation to the classification algorithm, and then completed on more than 100,000 assessments in relation to the prioritisation algorithms.
A 2023 report obtained under FOI warned developing the classification algorithm would be a relatively complex modelling exercise for the department. It would need to be performance tested to consider whether the funding results are fair and justifiable, and to ensure results can be vetted by subject matter experts. But there was no live trial of the final algorithm.
So the current version of the algorithm hasn't been trialled?
It wasn't formed part of that trial, no.
Was the current classification algorithm trialled on people before it went into operation, yes or no?
Like I said, Anne, it was developed over many, many years.
I'm not asking about the development, I'm asking about the trial.
Well, there were many trials.
Was it trialled?
There were many trials. There was expert advice taken all through the development process. It uses a range of clinical tools, verified clinical tools, to both collect the data and then, within the integrated assessment tool process, standardise the application of the aged care rules.
Who were the specialist clinicians who independently validated the final algorithm before it went live?
Well, there were many, many people, hundreds of people that were involved in the development of the integrated assessment tool. I'm not going to rattle off names.
The ABC has seen some names of clinicians who worked on the tool or questionnaire, but the department has not been able to provide names of those involved in vetting the final classification algorithm.
We have heard that maybe there were some clinicians, but the Australian Society for Geriatric Medicine is not aware of any clinicians being involved. And those clinicians have extreme expertise in the care needs of older adults and have previously always been involved in aged care assessments.
So is it unusual that nobody in the society was consulted?
I think it's highly unusual and surprising.
The fundamental idea that public servants develop and apply an algorithm is really a problem. They should never have been asked to do a job that is so technically sophisticated, it's beyond what you should expect a generic public servant to ever do.
The federal government has now allocated $18.1 million to review and refine the algorithms.
So you've got an $18 million review into it. You have a Commonwealth Ombudsman investigating it. You've got 1,000 people appealing it, which is 6 times the number from the previous financial year. Why don't you think there's a problem with the algorithm?
And I want to see the very best outcomes for older Australians. And so investing in constant improvement is a critical way to make sure that the $50 billion of precious taxpayer money that we will be expending each financial year of the coming financial years is invested to the very best that it can be to get the very best outcomes for older Australians.
The algorithm cannot be fixed by tinkering. It can only be fixed by ditching the whole algorithm and starting again, if you think that it's better to have an algorithm than an expert clinical assessor determine what a person needs.
The fear among insiders is that the reforms meant to help older Australians stay at home could end up creating much bigger problems. Today, in hospitals across Australia, there are thousands of elderly people with nowhere to go. In Adelaide, that's led to an extraordinary solution.
On this floor and the one below us, the carpets have been ripped out. There's hospital beds and medical equipment in all of the rooms, and there's nurses walking the corridors. There's about 50 patients in this hotel. Lots of them are elderly. Some of them have been here for weeks, but there's others that have been here for months.
If you had said perhaps 10 years ago that a state government would be funding rooms at a hotel like the Pullman, people probably would have been absolutely shocked.
The elderly patients here are stranded, too unwell to go home, but forced to stay here because there's no nursing home beds available.
Okay, so first patient is Mr. FD with advanced Alzheimer's dementia. He's been here for 324 days.
He's moved.
Across town at Hampstead Rehabilitation Centre, geriatrician Dr. Chloe First has more than 100 patients, some waiting more than a year for a permanent place in an aged care facility.
Okay, next patient is Mr. SB, 93-year-old man with post-stroke dementia. He has been here for 178 days. 87-year-old man with neurocognitive impairment. He has been here for 141 days. 247 days, this week's update. There are currently over 400 patients stranded within South Australian acute hospitals. So this is absolutely a crisis. I can't see this crisis being solved anytime in the next, couple of years minimum.
All right, I'll get you a drink, all right?
Philip Briscoe has dementia and has been at Hampstead for 5 months. His wife Sandra visits every day, while staff try to find him a bed.
Do you want something to eat, or you had enough? Want something to eat? He should be in a nursing home, but there isn't any. I mean, there's plenty of nursing homes, but they're all full. And he's taking up a bed for a genuine person, that's sick.
That ageing demographic that we've talked about for so long, it's the biggest challenge facing healthcare systems right around Australia. And the thing I think that really keeps me awake at night is that we're not in the middle of it. We're not at the peak. We're absolutely not at the peak.
The Federal Department of Health and Ageing estimates Australia needs more than 10,000 new residential aged care beds per year. In the 4 years up to 2024-25, an average of 1,800 new beds were created. In 2024-25, there were just 800. There are nearly 3,000 people over 65 stranded in hospitals around the country, up from at least 2,200 late last year. That's roughly a 25% increase since support at home was introduced. The reforms just started in November last year. Has there been a marked difference?
I think it's too early to say it. Hey Tina, how are you? We are worried about the increased cost of care in the community and what this is meaning for people. And it is potentially driving people into the acute space. Good. Does sound a bit congested there already. Yeah.
This year, the federal government said it had committed to investing $1.7 billion to encourage the construction of up to 5,000 new residential aged care beds a year across the country.
Which hospital were you in before?
But Dr. Chloe First says that doesn't address the issues with support at home.
We're still seeing that there is long delays to access home care, and the home care that is provided is often not meeting the needs of the individual at question.
What people are telling us, people in the sector, aged care experts, they're saying that the way that you are managing this is misguided. People are now being pushed into hospitals and residential care because they're not getting that care in home.
Well, I'll leave it for the commentators to commentate. What we are seeing is rapid investment. Investment in the aged care system has grown by 40% since we were elected in 2022. We've seen quality of care being delivered rapidly increasing. We're seeing wait times coming down. I want to be clear, there's more work to be done here.
Unless you have a needs-based, on-demand system, you are going to have all sorts of inequities, unfairnesses and injustices to older people who government agrees need services but won't give it to them.
I'm a realist. We don't have an endless aged care budget. What we should be asking is how do we reduce demand for the most expensive end of care if we don't reboot the system to remove the disincentives to ageing in place. My fear is the system may not be standing in the next 5 to 10 years.
Barb finally received funding to have shower rails and a ramp installed. She waited 6 months.
But I'll ring you as soon as I get home.
Okay.
All right, you right?
Yeah. You sure? Yeah. Come here.
It's okay.
Okay.
Back in Perth, after Audrey was knocked back for a higher level, her daughter Jan applied for another assessment. Once again, the algorithm said no.
I love you.
Love you too. I don't think this government actually realises the pressure and the stress that it's putting on the elderly and the people around them. I'll do anything to stay here. I don't want to go into a home. Not being able to see, I wouldn't know where I was or how to get around or anything. I know everything here, where I can go from room to room.
We visited Sean and Pauline to see what had changed for them.
Hello, Pauline. How are you?
I'm through.
Thank you.
Yeah.
Hello, Sean.
Lovely to see you again.
Lovely to see you again too.
In June, the government announced people with MND would be fast-tracked to get funding. But that's after they've been assessed for care.
So, thought we'd come back and see how things are going.
Sure.
So, first question, have you had your assessment?
We haven't had the assessment yet.
So they pushed it back to August.
Right.
We seem to spend all the time waiting. Waiting. It's very frustrating.
Sean and Pauline have now been waiting 8 months.
guess the worry is if something does happen to you, how would Sean cope?
Unfortunately, it's putting me into a home, I think.
Yeah, that's when he goes. There's no other way. I've been lucky so far. My health has held up. But if it goes, then he goes.